A time for change, to unmask the truth, to unmask the rot in our communities. Unmasking the Truth will focus on the effects of corruption on women, prefer solution and demand for accountability. Unmasking the Truth will be on this radio station every first Monday by 5:30 p.m. And we ask you to join us to condemn corruption, to demand for accountability, and to work together for a better Nigeria. Unmasking the Truth is an initiative of St. Ives Communications in partnership with Voice of Women and supported by the MacArthur Foundation. Good morning and welcome to Unmasking the Truth on Women Radio 91.7. My name is Sumto Titilayo Ajama. Thank you very much for tuning in to Unmasking the Truth this morning. Today we're discussing how corruption denies women from accessing primary health care centers. How corruption denies women from accessing primary health care centers. Primary healthcare centers are designed for local communities to access basic healthcare services. A high proportion of women in rural communities experience a lot of barriers in accessing their local healthcare. Corruption has now denied a lot more women access to basic healthcare due to the high charge of healthcare services and lack of equipment. Pregnant women who have no extra money to bribe with are often given poor or no attention, and this, of course, increases the likelihood of high maternal and neonatal mortality rate. So, Unmasking the Truth today on your radio station, we'll discuss how corruption denies women from accessing primary healthcare centers. Unmasking the Truth will look at how women are affected and how to fight it. My name again is Sumto Titilayo Ajama. Unmasking the Truth is an initiative of St. Ives Communications in partnership with Voice of Women and supported by the MacArthur Foundation. So, we spoke to women who have expressed their grievances on how difficult it is to get primary health care and its effect on them. Now, listen to what they have to say.
All my life, I've never used it because I don't attend to people on time.
Ó difficult gidi gan ni. Ó ṣẹlẹ̀ ní pé health center yẹn a ní ìdí gidi ládùúgbò yìí. Tá bá ní ọ̀sẹ̀ tá ń bí báyìí, wọ́n gbìyànjú láti fi gbogbo nǹkan fọ́mọ̀ pa máa ní tirẹ̀ tí kò máa ní di pé a máa tún máa ní láti máa rush lọ private hospital.
It's very far. Emergency is very far. But from this Arepo to hospital to Lagos, I spend 5 hours on long reach.
Tó máa rọ̀ mí lọ́rùn ní kí n lọ sí private hospital, government hospital, wọn kì í treat you dáadáa ń bẹ̀.
There is no an health center within Arepo, but other area like Wawa and Magboro, it's always a busy area. Sometimes because of traffic on the highway, driving out to get there can make it difficult in accessing the health center.
Now, you've listened to how difficult it is for these women to get primary health care, and you can tell sometimes that this difficulty is as a result of this issue of corruption, and it definitely needs to be looked into so as to save the lives of women. My guest today is Nurse George Onyinyechi Glory, a certified nurse and midwife. Hello, Nurse George. Good morning. Thank you very much for joining us on Unmasking the Truth. Can I call you Onyinyechi?
Yeah, sure.
Thank you so much for joining us.
Good morning, Tonto. Good morning.
Good morning. Yes, good morning. Thank you again. Now, we've heard these women talk about their experiences and the ordeals of how badly corruption has affected them, basically, because corruption is definitely involved in their difficulty in being able to access primary health care. So how do we get to this point as a society? How do you think we came about all this difficulty that we're experiencing today, particularly as it pertains to primary health care?
Countries plagued with by corruption can attest to the fact that once it becomes entrenched, it can be found in all sectors of an economy. But in low and middle sectors of income countries like Nigeria, the health sector is particularly vulnerable, according to Transparency International. This is because Competence and integrity are undermined by poor working conditions and weak systems. Corruption in the health sector also involves major key players, such as the people in government, medical directors, and even down to the staff. How did we get to this point?
Exactly.
Yeah. It can be traced to these following points. No, there are no proper monitoring of some materials that are sent down to the primary health care center. Some materials like mosquito nets, condoms, prenatal drugs for pregnant women that are supposed to be free of charge. But they are either being sold to them or they are either denied of these materials and sometimes diverted to other private facilities for sale. The people who are at the higher levels, where this material procurement are released, divert some of these funds and procure materials, and little or nothing come down to primary health care centers, which automatically affect the community and especially the women and their children. Usually, the women are consumers of primary health care.
Mm-hmm.
Yes. And if they don't get the proper and necessary services before and during pregnancy and after the delivery of their baby, this can expose them to high risk of maternal and child death, which is one of the major reasons of our present Nigeria. Thank you.
You see, Nurse Glory, it's interesting how you put this, because to a large extent, this is definitely a bigger conversation, and you've mentioned some of the reasons why. So talking about this, you can tell that corruption really does play a part in this, and it's becoming even more and more clear with time that this needs to be worked on. This can't be something that we just push to the curb and then we don't really talk about it, or if we talk about it, we don't really do anything to solve the problem. So thank you very much again for explaining that in such an easy way to understand. Unmasking the Truth looks at the effect of corruption from the gender lens, and it's important that we do that. So let's go back on the streets and let's get more comments from other women on the different situations they have experienced with access and their experiences in primary healthcare centers.
I remember I get one hospital like that. Then a government hospital where I go. As I go there that day, I supposed to do that test very early in the morning. The nurse wey dey on duty, she don already finish her work. The person wey come collect duty for her hand, that one just sit down. I even dey greet her, she no even answer me. She just dey there, dey make up. Dey waste my time like say I no dey important at all. I mean why that test wey I can't do dey very important.
Èmi ti gbọ́ ọmọ mi lọ sí center rí o. Tó jẹ́ pé rí solution sí nǹkan tó ń ṣe.
The worker there, they are not capable with their work. They don't even count a human being. They just do what they like there. They don't attend to people who come for treatment in their place.
Ìgbà tó mọ̀ mi wà ní wọ́n ní wọ́n yẹ mo ní ìwọ̀n kan ní government hospital kan ló tún mo tẹ́ láti lọ síbẹ̀. Ìgbà tí mo dé bẹ̀, thank God pé mo tẹ̀ mọ̀ wọ́n bẹ̀. Fẹ́bí mi ò mọ̀ ní wọ́n náà kí wọ́n mọ̀ yẹn ìwé bó ṣe ń treat mi. Ṣébí me myself bó ṣe mọ̀ yẹn tó yẹn náà ní orí business yìí. Ọmọ mi lọ́gọ̀ fún ní court.
The whole way they wawa, I don't know why government they do us like that. That place big, now like general hospital, but they no even renovate, they no do anything.
This is very interesting, and that's another unique point of view when it comes to their experiences in these different primary healthcare centers. And you've heard from the ladies, but I want to ask you this particularly. Looking at the situation with all these experiences that these women have gone through with primary healthcare centers, particularly with their children, and it's difficult, if we're being honest. It's very difficult. So how can we get the Nigerian Medical Association to look into these situations of the harsh experiences that they face with primary healthcare centers and awaken these medical officers to the plight of our women on a daily basis?
The The Nigerian Medical Association can be the attention can be drawn to this, and the necessary action should be taken.
How can we draw their attention?
This can happen when the Nigerian Medical Association can put in measures to monitor the quality of services that are rendered to the public, and to ensure that the people are actually receiving at least the average of the services meant for them. There should be timely auditing involving all the staff and that work in primary health care centers to be able to point out where there are core loopholes in the services that are rendered to the communities. And also, they should raise patient survey at intervals by issuing out questionnaires or face-to-face interviews to know the major concerns of the people in regard to the services they receive from the primary health care center.
So this way, the Medical Association can know what is happening and can know exactly the measures to use to fix this situation.
Yes, exactly.
Thank you very much. Unmasking the Truth on your radio station is an initiative of St. Ives Communications in partnership with Voice of Women and supported by the MacArthur Foundation. It's important to hear more voices, so we're still going to hear some more experiences about how these women have been treated and the experiences they have had in these primary health care centers.
If person go there go sef, you go even wan go borrow money to use private hospital instead wey you go use am because the kind mosquito wey go chop person for the place.
Gbogbo máa lọ sí hospital nígbà tó mọ ní ibà lára wọn wá gbé dáhùn pé bó ṣe jẹ́ center yẹn tó dẹ̀ jọmọ ekiri nígbà tí màá dẹ̀ fi dé ọ̀hún yẹn náà bá ní kí máa sọ pé màá gba káàdì náà ní 1000 mo bá ti fún ọ lówó tán wọ́n tún náà máa ṣe test kan kí n ti mú owó wá wọ́n á bẹ̀rẹ̀ sí í sọ̀rọ̀ mo ní ṣe bẹ́ẹ̀ sẹ́ńtà náà pé bíi pé ọmọ kọ̀ ní malaria lásán ó kírun oògùn báyìí kò dáa kó fọmọ kékeré ní abẹ́rẹ́ bẹ́ẹ̀ tó máa nílò oògùn tí ó máa lò kọ́dẹ̀ fún mi ní oògùn lẹ́gbàá tí mo ti sọ 1000 tán kọ́ fún mi ní oògùn náà bá ní kò sóògùn lẹ̀ gọ́ọ̀mẹ̀ntì kò kóògùn sílẹ̀ kò ṣe gbá kò ṣàwo ó yẹ kọ́ fún mi kí n lọ rà níta àwọn ní ìrọ́ máa kọ́ fún mi bẹ̀ kí n mówó ẹ̀wà máa mú kinní síta ẹ bá mọ́ògùn síta máa sọ owó ẹ̀ bọ́ ṣe ṣí dry wọn nìyẹn nígbà tó máa ṣí dry wọn ṣàkóògùn síta nígbà tá a fi kó oògùn tí ń lọ bíi 3000 gọ́ọ̀mẹ̀ntì hospital náà pélé ìbọ̀ tí owó tó tún wá ń gbà báyìí ó tún gbára.
The health center government are not taking care of the place. Place used to rough. Even the net there, if it's there, they will not replace it. The chair will break. Everything there will just happen.
Everything there will just scatter. This is basically the words of some of these women who have been to these primary healthcare centers, and you can tell the pain that comes along with them relaying these experiences. So let me come back to you to ask this now. What are some of the possible strategies that the local government, since the primary healthcare centers are located under the jurisdiction or umbrella, so to speak, of the local government, what are the possible strategies that the local government can use to improve these women's access to primary health care facilities?
They can actualize that by focusing on women engagement. Because women can be the first advocates for their own health, but they have to first be engaged and taught to be proactive healthcare consumers. Primary healthcare providers should think more holistically and find effective ways to connect and encourage communication between family healthcare providers, insurance providers, and social services throughout the patient's entire primary healthcare zone. Primary healthcare providers should also organize door-to-door evangelism and awareness campaigns on the services they render.
That's very important. That's very important. Do you think that the local government can actually make this happen? Some of these suggestions?
Yes, they can. They can make this happen. When the women are involved in this journey, it makes it easier because they are the highest consumers of primary health care. So when you enlighten them and get them engaged to be proactive healthcare consumers, it will help a lot of other women and also the community members to really have access to good family health services.
Thank you very much for that. Now, let's talk about how this is an issue right now and what can be done going forward. But let me ask you a question first. Can the poor medical access for women in rural communities, can you liken it or can you attribute it to the lack of women in governance? Can the poor medical access for women in rural communities be attributed maybe to the lack of women in governance? What do you think? What do you say to that?
Not exactly. I don't really think so. But somehow, full women involvement in governance will help get a better review of the services that are lacking. However, making medical services accessible to the public it shouldn't be gender-based. Rather, it should be focused on actualizing the aim of primary health care.
I understand.
So I can say yes or no, like it's not exactly the public health services. It should not be gender-based. But rather, it should be focused on actualization of the aim of primary health care centers.
That's an interesting point. A school of thought would say that if there are more women in governance, these women will be able to continually bring up these topics of getting better medical access for women in rural communities to their primary health care centers, and even furnishing, renovating, rebuilding, if need be, more primary health care centers, because these women understand the pain of the women in the rural communities. But because it's a more male-dominated space, it may be that may be one of the least things that the government might be thinking about, because again, there are not that many women to remind them. So it's not that they don't know, but maybe reminders are needed, and that would be encouraged with the presence of women. Do you agree with that school of thought?
No and yes. Women have some representation in some sectors, and they haven't really been able to effect more changes. However, I believe women who have the heart or drive, maybe from experience, might be able to do something.
All right. Thank you very much for that. Let me now wrap up with this particular one, and I would really like your answer to this one. Medical supplies that are meant for public hospitals, you even said this, that sometimes it never gets to them, and it's sold to private clinics, and these clinics charge more for drugs. And at the end of the day, it makes some of these healthcare centers lack the basic supplies necessary for the care of their patients. What measures can the government put in place to ensure that these supplies are actually delivered to the healthcare centers? You mentioned this earlier, so I'm asking this just to shed more light on that particular point.
There should be at least regular auditing of drugs should be carried out at primary health care centers. Drugs or materials meant for public hospitals should be tagged so that they can't be sold to other private facilities. And there should also be accountability. There should be monitoring teams to ensure what was ordered or released was actually delivered to the primary health care centers. And people in position to actually take stock and ensure supplies are used appropriately, then we would have reduced this to a greater degree when this happens.
Okay, so let me ask you this again. Is this the responsibility of the federal government, or of the state government, of the local government?
It is the responsibility of the local government to handle this.
All right. Yeah. Thank you so much. And in reference to the access of women to their primary healthcare centers and how corruption plays a role, how corruption helps women deny their access, basically, not even help women because it doesn't help them. How corruption denies women from accessing these primary health care centers. You've talked about how it's important for all these measures and strategies to be put in place, even by the Nigerian Medical Association, to make sure that these checks and balances are actually implemented so that the primary healthcare centers can actually receive their quota of drugs, of funding, of renovations, and they can be able to take care of these women. What are your final words in respect to this?
My final word here would be for the primary healthcare centers to maintain their image of the primary healthcare centers. They were brought to the communities for a reason. And those reasons should not be defeated. The primary health care center is the first level of contact of individuals, family and community with the national health system.
Mm-hmm.
It brings the health care to the doorstep of the people. And the aims of this primary health care center which include immunization, prevention and control of endemic and epidemic diseases, maternal and child health, including family planning, environmental sanitation, health education, adequate nutrition, provision of essential drugs, and appropriate treatments of common diseases and injuries, mental and dental health care should be passed across to the community as what it was brought to the community for. The aim should not be defeated. So I will encourage healthcare providers to try their best to uphold the aim of the primary healthcare center. And for the people involved at the top, the local government, chairmen, and the people involved in primary healthcare centers, to impute monitoring teams to help curb these issues and complaints from the public, and to also promote good and quality health services in the community. Thank you.
Thank you very much. Thank you so much for joining us today on Unmasking the Truth. Thank you, Nurse George Onyechi Glory, for unmasking the truth on corruption with me today. Thank you very much once again. Please enjoy the rest of your day.
Thank you for having me.
Now, in the words of Nurse George Onyechi Glory, poor access of women to maternal health services in the primary health care centers, that's a big challenge. And it needs to be checked to ensure that the lives of women in the society are safeguarded. We urge the government at all levels to look into the primary health care centers, not just the local government, but government at all levels, to ensure also that communities that do not have health care centers get one, and not just one, this time a standard one. So, thank you very much once again. And if you have a story on corruption in your community that you would like us to talk about, please share your comments by text and WhatsApp to 0703 175 6537. 0703 175 6537. Unmasking the Truth on Effects of Corruption on Women from the Gender Lens is an initiative of St. Ives Communication in partnership with Voice of Women and supported by the MacArthur Foundation. Thank you very much to the producer, Omozele Omore, and of course, executive producer, Tonwo Okewale Shonaya. My name is Sumto Titilayo Ajama. Good morning. A time for change, to unmask the truth, to unmask the rot in our communities. Unmasking the Truth will focus on the effects of corruption on women, prefer solution and demand for accountability. Unmasking the Truth will be on this radio station every first Monday by 5:30 p.m. And we ask you to join us to condemn corruption, to demand for accountability, and to work together for a better Nigeria. Unmasking the Truth is an initiative of St. Ives Communications in partnership with Voice of Women and supported by the MacArthur Foundation.
WFM 91.7.